Here and Now, the program featuring the news and interests of the African American community. Here's your host, Sandra Bookman.
Coming up, mental health and black men, how the Arthur Ashe Institute for Urban Health's Barbershop Talk with Brothers promotes community health and wellness. Also ahead, The Black Family Who Built America, the new book that tells the story of the McKissack family, builders of the nation's largest minority and women-owned design and construction company. Plus, Black Farmers United New York State on the impact of the Trump tariffs. All that and more on Here and Now. Black males are 40% less likely than other men to seek mental health treatments. That's according to the Centers for Disease Control. The Barbershop Talk with Brothers initiative is meeting black men where they are while encouraging them to seek counseling when they need it. More than 100 barbershops in our area are part of the Arthur Ashe Institute for Urban Health outreach program. And joining us today is the CEO of the Arthur Ashe Institute for Urban Health, Dr. Marilyn Frazier, and Jerome Archer, owner of the Platinum Cuts Unisex Salon in Bed-Stuy, Brooklyn. Thank you both for being here this afternoon. So nice to see you again, Dr. Frazier. If you don't mind, remind our audience of exactly why the Arthur Ashe Institute for Urban Health was established.
Arthur Ashe, the tennis champion, humanitarian activist, started the Arthur Ashe Institute just a few months before he passed away to do what we'll talk about, to educate people within the community, to also increase people of color in the health professions. And we do that through our health promotion work within beauty salons and barbershops by training barbers and stylists to talk to their customers about health, and also to link people to services so that they can obtain care. And then our Health Science Academy is another program that increases people of color in the health professions.
Yeah, I know you've been doing this work for a while, successfully. Yes. Jerome, bringing you into the conversation, why is this a program that you felt like it was important for Platinum Cuts to be a part of?
Mainly because barbershops and salons are mainly where people meet to network and talk and collaborate and figure things out according to what's important in our lives. At the moment, it felt fulfilling to me as a person. Even though I'm the owner of the shop, I'm also seeking help and guidance. So that's why, when Arthur Ashe came to me with
with the idea be part of this?
Being part of the Barbershop Talk, I jumped right into play.
Yeah, it was a no-brainer. Yeah. So I got to tell you, I think guys gossip more than women do in the barbershop. Tell me I'm right or wrong.
I wouldn't call it gossip.
I know. I'm teasing you. But they do talk to each other, and they talk about a little bit of everything. So were you surprised? So how easy or difficult was it to get your customers to, to listen to the conversation about this and to actually start talking about some of these issues?
It was easy, mainly because we have those conversations already. We just have an ear to hear us. And more of a strong connection or platform where we could trust where we get the information from. It's not just talk no more, it's actually facts.
Or hearsay.
Yes.
Yeah. You said something interesting that when they came to you, had you given much thought to, I don't know, talking to a counselor or, being comfortable talking to somebody about your problems or issues or worries of concern before you, got to be part of this initiative? Had you thought about that at all, or?
At an early age, no.
No, yeah.
Because it wasn't popular. It wasn't something that black men did.
Yeah.
The era of, man up. The era of stop crying, I was raised in that era. But as we move forward, and now I have sons, it's mainly rewarding to be a part of this because it's helping me raise not just my community, but my kids in a truly special way.
Yeah. As you hear that, Dr. Frazier, you have to think, That is exactly what we were after.
Exactly. That is what we want, that people are making that conversation more normal within the community, that is reducing stigma. We know that there's a lot of stigma that's associated with mental health and mental well-being. People just don't talk about it, and people suffer in silence. So yes, this is exactly what we want. We want those conversations happening, and those conversations seeming normal to happen within the community.
Yeah, and I think because we're probably being a little generic and vague here, when we say conversations, we are talking about everything from whether it's health challenges or relationship issues, aren't we? We're talking about a variety of things.
We're talking about a variety of things. We're talking about health. We're talking about things that are happening in the media. We're talking about misinformation. We're talking about things that people may see on the internet, whether that's real or not. We're talking about a whole host of different things that happen within that trusted environment. And so why not guide those conversations? Why not provide the information that's true, the information that's trusted, so that people can get the help that they need?
So Jerome, how long have you been part of the program?
23 years.
Okay, that's impressive.
23 years.
And when it comes to what the guys are talking about as part of this, has that changed at all? Or what are some of the topics that you guys have discussed and over time? Just anything that you remember. And has it changed in the 23 years?
It has changed from us talking about not just jobs, not just relationships. It's more of our personal health, as far as what we put in our body, not just what we eat, what we listen to, what we watch, who we hang around. Those type of conversations are more dominant in the barbershop now, as it wasn't earlier in my career.
Is there anything that's, any issues that are common that keep recurring that maybe surprised you?
The definition of a man keeps changing. Once you hit what you think a man is, the world changes the rules, or changes the narrative, or changes the title. So that puts us in another perspective of mentally gathering ourselves to accomplish the next goal, because it's never going to stop.
And you mentioned that you have sons before, so it was really important to you to take this on and broaden your perspective even about some things. So is it in the barbershop, do we have men of all ages? Do you find that older guys are more reluctant, or younger guys reluctant, or just everybody becomes part of the conversation?
Becomes a part of the conversation, because just because you're older doesn't mean you're more accomplished or educated than a person that's 10 years younger than you. So it starts out as a respect thing. It's a safe zone from any conversation that comes up. There's no bashing or looking down upon. But the conversations are very important, and to close the gap, it has to be ages. That's different. It has to be different perspectives. It has to be different views and experiences, to not come to a conclusion, but come to a better way of living, or a better way of handling things.
Yeah, and a different understanding maybe than what you walked in with, because you've heard from various people of various ages and life experiences.
Life experience, time zones and things of that nature.
So I have to ask you, Marilyn, how do you, this is part of your larger initiative, do you provide the experts, for lack of a better word? Do you, how does that happen? Do you schedule a time that this is going to happen with the barbershop? How does that work?
Yes, so we do provide the experts, we provide the training for the barbers, we provide the resources for them, and also work with the barbers to schedule a time that's appropriate for them.
Yeah, that works.
Not just like, okay, we're working from 9 to 5, and so we want to go in at 2 p.m. and they're saying, well, no one is there at that time. You have to come in on a Saturday afternoon, or you have to come in evening. So we work with the barbers, and for the other program, work with stylists as well to schedule the time that works for them. We provide the training, we provide the resources so that people can be linked to services.
Yeah, I mean, it's one of those things, like almost a no-brainer. It just makes sense,
It makes sense.
There's a stat here According to the U.S. Department of Health and Human Services, in 2021, the death rate from suicide for Black men was more than 4 times higher than for Black women. When you hear something like that, Jerome, does it, I guess, help you to even feel better about the fact that you decided more than 20 years ago that this was important to be a part of the solution? You know, that statistic is just crazy to me.
Daunting.
And some of that is likely people that didn't know where to go for help or know to ask for help.
Yes.
You know, does that make you feel even better about the work that you have been doing for these last 23 years, not just for your family, but for your community?
It does, and such a high, value, because I get to see the results. Mm-hmm. Sometimes they're good, sometimes they're bad, but I get to see the results and get to speak to Dr. Frazier and the team to strategize this. Okay, this isn't working anymore. This is something that I think or that I see, and we have our community meetings or just small conversations, and again we come up with what's next, and I'm very proud to say I'm part of that.
Yeah. Yeah, you are just in the work that you do and the service you provide to the folks in your community. And I do have to ask, is there something similar, because hair salons, we're talking about everything there when we're not, a similar situation?
Yeah, so something similar is happening in the hair salons too. And yeah, we do talk about
women talk, I think we talk more about everything.
We talk, so something similar is going on there as well. Yeah. We've done these paint and heal sessions, both in the barbershops and the salons, so that people can paint, and while they're doing that, it reminds them of play a little bit. Mm-hmm. And while they're doing that, they're hearing about strategies to relieve stress and coping mechanisms and so forth. So it's really exciting.
And this is really, this program is emblematic of what Arthur Ashe was hoping to do when he established the Institute, right?
Exactly. The same things that he was hoping to do in terms of people going out into the community, meeting people where they are, where they congregate, and doing health promotion that impacts people's lives, so that we can change and move that needle when we think about health disparities and health inequities.
And maybe save some lives.
And save some lives.
If I'll send folks to arthurasheinstitute.org, they can find a lineup of the many programs that you offer, find out a little bit more about the Institute itself. And Jerome, your barbershop is in Bed-Stuy. Tell me the address again.
The address is 508A Nostrand Avenue, Brooklyn, New York, 11216.
Platinum Cuts. Inc. All right. Thank you both for joining us this afternoon. And
my pleasure.
Bless you for doing really important work. You didn't know you'd be saving lives when you were cutting hair and shaving folks, did you?
No.
But you are.
But I am.
Changing them too. Thank you both.
Thank you.
We'll be right back. For more than 200 years, one African-American family has been at the forefront of literally shaping the landscape of America. McKissack & McKissack, the largest minority and women-owned design and construction company in the nation. The Barclays Center, JFK's Terminal 1, and the Oculus at the World Trade Center, just a few of the projects that they've completed. That legacy and riveting family history is laid out in a new book, The Black Family Who Built America. It's our pleasure to welcome back the president and CEO of McKissack & McKissack, Cheryl McKissack Daniel. It is so nice to see you again.
Same here, Sandra.
I only invite you here to laugh. I love to hear your laugh.
Well, that's easy for me to do. I love to laugh.
You've got a lot to laugh about and be happy about. Your family's history, it really is riveting. One of the things that surprised me most is that you were able to trace your lineage back so far. Moses, the first McKissack in the country. When did you learn his story? Did you know his story as a child?
So I had heard about it, but one day my mother shows me this family tree, and I must have been 9 or 10 years old, and I was just fascinated with the family tree. and it was written out, and it was old and falling apart, and you could barely make out some of the names. And I said, you know what? I need to take this family tree and redo it so we can all read it, but also carry it out to our generation. And so I was able to do that. And so, you know, going through that whole process, I began to hear all the stories. And I tell people now, you know, I was on a show earlier today, I said, you know, if you are interested in your own legacy, just start writing a chart of who you do know.
Yeah, connecting the dots.
Yes, right. And then fill it in later if you want to get a genealogist or something like that. But do write down what you have, or just start it with yourself, because whoever your offspring are, they can carry it forward.
One of the things I love about your story is that it's not just a story of, you know, tales of ancestors passed down. You kind of have brick and mortar to bolster all of this, which is one of the things I just think is so interesting, that your ancestors that first arrived learned this skill here, and we're talking 200 years later, and you guys literally have built America. You have to be, I mean, I know I covered a lot of ground in between, but you have to be so proud of not only being able to tell the story, but to show people what you've accomplished.
Yes. You know, to me, I agree. It's an incredible story, because having a family business for 5 generations is just unheard of. I mean, 1 in 5 businesses, they fail in the first year. And, you know, to pass a family business down to the 2nd generation is only 65%. And then to a 3rd generation is 18%, and to a 4th generation is 3%. So to be able to pass a business down 5 generations, and of course the 6th generation is sitting in your green room, is absolutely incredible. But Nick Childs and I make a case as to why the McKissacks were able to do that throughout the entire book. And it goes all the way back from the beginning, how slaves were treated from one state to the next. Some states were more lenient than other states. And so they were in North Carolina, where it was more lenient because you had less slaves. Each slave master had less slaves, as opposed to having huge plantations. I mean, if you are a slave owner with a family of 5 and you have 300 or 400 or 500 slaves, then you have to treat them a certain way to keep them under control. And so there has to be this level of fear, right? 300 people can take over 5 people easily. But when it's 10 or 12 slaves, the slaves really become like extended family. And so they're working alongside of, you know, the slave master's family. So, you know, we make this case as to how the McKissacks were able to re-engineer over the last 200 years to remain relevant, and how to build this legacy.
Now, the story is fascinating, but I think that as a woman, I love the fact that, because when you start talking about family businesses a lot of time, especially back in the olden days, everybody just thinks about leaving it to the son. You know, that the son's going to take over, that they're going to be. And one of the things I love about your story is that it's you guys, the women, that have continued this legacy and built on it incredibly.
Yes, well, my mother made sure of that. Leatrice McKissack, she took over the business when my father became ill, and that was in the mid-'80s. And in the mid-'80s, women could not borrow money. That didn't come
Couldn't
about.
even have a credit card.
Couldn't have
in their
anything
name.
associated with dollars. And so it wasn't until the Women's Business Act in 1990 that allowed women to start, you know, borrowing money from banks. And she was in business, running the business like 7 years before that. And, you know, it seems like just yesterday, 1990. I mean, that was the year Spike Lee's movie She's Gotta Have It came out.
Okay. I don't remember you mentioning that in the book. Okay.
And EU's song Doing the Butt. Okay.
So you were, well, I kind of know what you were doing in the 1990s.
That yesterday?
Yes, that's what it feels like to me too. I agree.
And so she was a very strong leader. She wasn't an architect. She wasn't an engineer, but she had this master's degree in psychology. And we have joked over the years just to say that she was able to use that degree to deal with the manias and phobias of men who couldn't understand that a woman could run a business.
Why did you think this was the time to write this book, to put that story in print and share it with the rest of the world?
Quite honestly, it wasn't my timing. It was God's timing. I have been working on trying to get the story out since 2003, and I've had many failed starts, tried to do sitcoms and things like that. But it wasn't until I met Nick Childs that he was really able to tell the story. It's unbelievable how hard it is to put 5 generations in 250 pages.
Yeah, that takes some research, interviews, and yeah.
Yes, and make it interesting and not boring.
Well, the story is interesting. I mean, the interest, I'm fascinated by it. In fact, I want to ask you, do you have is there a favorite chapter or section of the book that you just really felt represents, how you feel, or the things you really wanted people to know?
Is there one? I'm not sure there's one chapter. There are a couple of chapters that
or maybe
I
a
think
project that you worked on
so
that you
really
really
relevant. But I love the chapter on financial clearance.
Oh. Okay, that's why you're successful.
Financial clearance. I love that chapter. Because it is the epitome of what we deal with as a minority or Black-owned, woman-owned firm. You walk into a room, people don't expect you to lead, they don't expect you to add value. And, every single time you're having to prove yourself. And every time you prove yourself and you meet one milestone, they change the goalpost. And so that chapter is all about how the goalposts can be changed and the rug can be pulled out and you can still persevere.
Yeah, we've heard that story over and over and over. I mentioned leading into this interview some of the projects that you've worked on here. JFK, the Oculus,
yes,
which is gorgeous. And you working on a project right now, a skyscraper that's pretty impressive, right?
Well, if you're talking about Affirmation Tower, that did not happen. But we are working on 270 Park, which is J.P. Morgan Chase's new corporate headquarters, which I call the eighth wonder of the world because there's so much beautiful steel in that building. We are working on the trading floors, which we will turn over to J.P. Morgan Chase in late October.
The truth of the matter is, your sister, you guys are so brilliant, you could have done almost anything.
Yes.
Would you say this construction, this design, that it's just in your blood?
I believe it is now.
Okay.
Because I feel so natural in it. I don't know anything else. So I can't speak to, what it might feel like to be a doctor. But I can say that this is natural for me. And, understanding what our legacy is about and how that has impacted my life, then I truly believe that it's in my bloodline.
Yeah. When you go into a city, do you feel compelled to at least pass by the projects you worked on?
Yes.
There's so many of them, yes.
I was just in Nashville, and I go to Nashville all the time. But I will certainly drive through Fisk University or Tennessee State, and each time I do that, I'm thinking, well, what was my grandfather thinking when they did the ribbon cutting for this building? What must have that been like when, back in the day?
Yeah.
Because they had crews all over the Southeast. And, can you imagine you could only see your crew like once a month because you were traveling?
Yeah. Well,
during the day.
What would he think about, what would Moses think about the fact that you guys were behind that king statue in Washington? I mean, there's just amazing things that he would never have been able to even visualize in his lifetime.
And that's my twin sister, and I compliment her on that. That is an amazing project, and I think he would be proud of all of our projects.
Yeah.
And just feel like it was worth his struggle.
Yeah.
I mean, because their struggle is even greater than ours. I get
Different,
asked
for
all
sure.
the time about the times we're in, and do I have concerns about DEI programs, being slashed, and trying to erase our history, and that's another reason why this book is so relevant now. It's a receipt to say, we've always been here, we're not going anywhere.
Yeah.
But when I think about what they went through compared to what we're going through, which is short term, it really doesn't bother me. I am not in any way concerned about the administration we're in.
Yeah, no pun intended, but I think the foundation that you guys are standing on is pretty solid because you built it yourself.
That's right.
Right?
We built it. Literally.
The book, The Black Family Who Built America, the McKissacks, 2 Centuries of Daring Pioneers. Cheryl McKissack, Daniel, it is always a pleasure to talk with you. You should get this book. It is really wonderful reading. Thank you so much for sitting down with us.
Absolutely.
Okay. You have to come back.
Okay.
And we'll be right back. For more than a century, the Urban League of Essex County has provided vital services that promote economic advancement and stability. And now with federal funding cuts impacting nonprofit organizations nationwide, the League, like many other organizations, is facing some challenges. Here with more on how her organization plans to continue providing the needed services is the president and CEO of the Urban League of Essex County, Vivian Cox Frazier. So nice to meet you.
Nice to meet you.
When you say Urban League, you immediately think of getting things done. No. And based on the long list of services that you guys have provided in Essex County for, what did it say, more than a century, you are used to being able to get things done. With some of the funding cuts that we've heard so much about in the last few months, is that impacting your organization?
Absolutely. So many of the vital services we provide, so generally speaking, the Urban League has been a social service organization. Over the years, we transitioned to be social service, community development, also housing. But the social services really are the safety net programs for families, and those generally are provided by the government. So recently, we've lost a significant amount of funding, more than $2 million in funding related to our seniors program. So low-income seniors who need that support to help get back into the workforce are now, that program was cut. And we're still trying to negotiate to get that funding back up. But right now, over 200 seniors were impacted by that cut.
And how, so when you lose funding for a program as important as that, you still have it in the back of your mind, we got to figure out how to help those people.
Yes,
what do
yes.
you do? Do you try to go to private donors? Do you figure out how to rejigger the finances that you do have on hand to try to make them spread a little bit farther?
Yeah, I like that term, rejigger. I actually tell people, it's like nonprofit Tetris, right? So, and I've been doing it for 20 years at the Urban League, and that means like you may generally lose funding for one program, and you try to backfill it with other funding. The situation we're in right now is more of a crisis situation, which is almost every program that we provide, from early childhood programs to seniors programs, after school program, all those fundings are being cut. So it makes it even more difficult to try to backfill, to try to just juggle and to jigger what you're saying, because there are many, many moving pieces. And the program for the seniors was really significant because it actually placed those seniors in organizations, and they were paid 20 hours a week wages. So we can't necessarily replace that, but the Urban League has a holistic approach to helping families. So the seniors that are being placed, we have workforce development, financial coaching, planning services, housing services. So we know that those seniors, now that they've lost their income, they're going to need support in housing and employment. And those are other services that the Urban League wraps around. So generally speaking, we're all hands on deck to wrap around other services, to refer the seniors to other programs. And also, we also do seek private donations and funding to continue all the programs.
And how open and how open to these private sector folks have they been to contributing and providing some of the funding, or are you still in the process of trying to figure out who can help, where, how they can help?
Sure.
Because again, just about every, especially nonprofits, are going through this situation. And a lot of it is not out of meanness, or some of it is just, if the state doesn't have the money to give you, they can't give you the money. If the county doesn't have the extra money to give you, they can't give it to you. So that's the position that you find yourselves in. So how are you seeing members of the private sector, private companies, individuals step up, trying to help replace some of those lost funds?
Yeah, so many of the supporters of the Urban Leagues, we get corporate funding as well as foundation funding. Many of those entities have, in fact, increased their donations and contributions to the Urban League because they know we are actually in this position, right? And the vital services that people have depended on, we want to continue to provide, and our supporters want us to be able to be in the position to do that. But just like some funders have stepped up, some actually, the environment has had some pull back.
And some of that, I can imagine, we've talked with other guests here, some of the DEI bans have really impacted how and where companies give, at least in the short term, I guess, until they can figure out how to navigate these new waters. I just wanted to touch on some of the programs, because we keep saying that you guys do a whole lot, and you've done this for a long time. The food pantry that happens every Thursday, that's one of those things that are one of those services that's even more important these days.
Sure. Right. We hadn't always we didn't always have a pantry, but in the pandemic was when we realized that families really needed it. So that's when we started with the pantry services. But I'll say the pantry is also part of a holistic approach to improving health, and we also have community gardens and things like that, all are focused around helping people to improve their health and to advance economically.
Yeah. Also, you mentioned it before, the early childhood education, and an important resource, I can imagine, for parents in Essex County.
Yeah, from infants and toddlers all the way to preschoolers, we have an early childhood program, and that program actually, because of the federal cuts, of families that are seeking to enroll their child and to get child care subsidies, as of August 1, you can't enroll. They're not taking any new enrollments. So a young mother with a baby now cannot now get subsidy for her child to go in child care. So how does she go back to work? I mean, this is really the situation that we're facing.
Yeah, and I mean, I think you pointed it out, that it has a domino effect.
Absolutely.
In so many ways in the community. And you mentioned the Affordable Housing Development Program, didn't you, for seniors?
Yes, so we do build housing. So we focus a lot on home ownership because the Urban League really is focused on helping families advance economically. And so we build affordable housing. And we've completed several homes for home ownership.
And before I let you go, I do want you to touch on your the annual gala event. That's one of your most important fundraisers. That's in October?
Yes, so we have our annual fundraiser, and it is our major way to raise unrestricted money. So actually, in this time of programs being cut, it is more important than ever as a source of funds for the organization. It's October 21st. So it'll be at Nanina's in the park, and we certainly encourage people to buy tickets, tables, sponsorships, ads, and a great time, a way to actually promote and support the organization, and to actually give you a chance to see the Urban League's work in action as well.
Yeah, you guys are in action for sure. The website is ulec.org. That's Urban League of Essex County.org, ULEC. Buy tickets to the gala and donate. And take a look at some of the programs that are wonderful programs that are available. Thank you so much for talking with us this afternoon.
I enjoyed it. Thanks for having me.
We'll be right back. Black farmers account for less than 2% of all farmers in the U.S., according to a U.S. Department of Agriculture Economic Research Service report. Historically, black farmers have dealt with challenges accessing capital and even land ownership, and now many fear that Trump tariffs will threaten their ability to compete. Black Farmers United New York State advocates for ownership, policy development, and networking. Here to tell us more is Martha Williams, Executive Director of Administration and Programming for Black Farmers United. Martha, thank you so much for being with us this afternoon.
Thank you so much for having me on.
So if somebody asked you to describe the state of black farmers in New York, what would you say at this point?
I would say it's a bit mixed. Part of it is that we're doing well supporting each other as we always had to because our government has always discriminated against us, but we're also struggling in some ways, in part due to legislation that has been taking away even more resources like land and funding from us, and also from the lack of markets that we have access to, like cutting programs like the local food purchase assistance cooperative agreement program and others like that that allow us to access markets and have governments purchase from us, smaller local farmers, Black farmers in New York State.
So when we talk about Black farmers in New York, can you give me an estimate of how many folks we're talking about, whether that's by actual numbers or acreage, however, what measure would you use?
Sure, it's under 200. We make up about 0.27% of all New York State farmers. And that's about a 47% decrease over the last century and only a very slight increase from 2017 during the last New York State or USDA agriculture census.
And why do you think we are seeing the number of Black farmers drop, not just in New York State, but around the country?
Yeah, it's definitely in part due to discrimination. And I would say before, like I'm mentioning the mention of cutting different programs that are important to funding the work that we do, but also because of things like heirs property law that takes away land that has been in families for generations. One person decides to sell it and suddenly all the land is gone. And then in addition to that, they don't necessarily have access to the educational resources or the financing. So you may want to apply for a loan through the Farm Service Agency, and you might have you're more likely if you're a Black farmer to have that loan denied, like we have cases here in New York State that speak to that, like with Liberation Farm. And we also have people not able to access the resources of learning the educational technical skills of agriculture. So we have different organizations that work towards that, like Farm School NYC, but then because they have cuts in funding, they aren't able to really address the immense interest that people have in farming. So they might want to get started, but they don't know how, and there aren't resources for them. And when they go to places that are supposed to provide those resources, they're rejected.
Now, one of the things you talk about the lack of funding and long-term discrimination. Yes. There was a remedy for that. The $1.9 trillion American Rescue Plan Act that was signed by former President Joe Biden, and it set aside billions in debt relief to try and help some of these disadvantaged farmers and also address the USDA's history of discrimination. What is the status of that funding?
Many of our farmers have never seen it. And I know that wasn't because there are individuals within those agencies that really care to give that funding to them. And it's not that they didn't want to, but because of the pipeline and how the funding comes down, it just never really reached us. And when you're cutting even more programs that are set aside for us because it's considered DEI to include us within things, we're not seeing that funding. It's missing our organizations. It's going to very large organizations that admit to not serving Black farmers because they're not in our communities. They don't see us. They don't know where we are.
So your feeling is a lot of that money, at least some of that money, essentially went to some of the agencies that were doing the discriminating.
Yes.
Under the current administration, there's been talk amongst many organizations about funding cuts from the federal government. What funding cuts have impacted your members?
Our members specifically. I would say that some of the biggest ones had been personal, I wouldn't say personal, but very specific contracts between our organizations. For example, with our organization, Black Farmers United New York State, we had a contract with the NRCS, which is the Natural Resources Conservation Service, and we were going to put on this big conference that was based on the Black Urban Growers Conference, which is an annual conference that happens all across the country that bring across lots of different farmers and other people engaged in agriculture that may have gardens that are community gardens that aren't necessarily recognized as farms but are feeding their communities as well. And then when this new administration came, because we were speaking to specifically the needs of Black farmers and farmers of color, smaller farmers in New York State, it was considered DEI and that funding was cut. Our contract was terminated and then we weren't even able to get reimbursed, and it's still up in the air as to whether we'll ever see that money. And very similar stories have happened with other organizations like Corbin Hill Food Projects, like Farm School NYC, like Northeast Farmers of Color Land Trust, where you have these contracts where you're bringing funds directly to farmers, the farmers that we know and personally work with, or our farmers ourselves, And those contracts were cut. They were terminated without much warning at all. And then we're not even sure if the money that we have spent will be brought back to us because we were committed in those contracts.
As folks listen to the story of Black farmers, this history of discrimination, this history of having a hard time getting money that is much easier for other farmers to get, farmers from other communities to get, why should we care? Why is it important, in your estimation, for people to acknowledge what is happening with Black farmers and really advocate on their behalf?
Because Black farmers are in all of our communities, whether we see them or not. We have a distribution within Buffalo, within Ithaca, New York, within Albany area, Hudson Valley, so on and so forth. And they're feeding our communities. It could be as small as an organization in Newburgh, our core, where they bring like dozens of youth from different towns together, and they're learning about how to grow, and they bring home food to their families who would otherwise be food insecure. It's bigger farms that work together and are shipping food to Harlem from upstate, which is a market that we have going on with Corbin Hill Food Project and other organizations. And they're there showing up. They're a part of those communities. We have some of the worst food insecurity in the same areas where we have our Black farmers, like Rochester, New York. And they're there every day out there with them in those communities, being a part of them, living there and feeding them and teaching them how to use things that they might have forgotten how to use through generations of lost knowledge because of people having to move to different locations, not being able to sit down with their family members and learn about that knowledge that they had acquired over the years of being here and before we were even brought to this country to begin with. So it's important because these people are feeding us. They're our local farmers too.
And how can someone listening to this interview today not only find out more about the issue, more about the farmers that are in their areas around the state, how can they get involved with helping you on your mission?
I think one of the best ways they can get involved to start is to go onto our website and sign up for our supporters list. If you're interested in joining our membership, we'll be opening that up again soon. And then you'll be able to get involved with different policies that we're working on, like the Good Food New York bill, like the New York State Urban Agriculture bill, and then other Youth and Ag bill. And you could also get involved with things like material swaps, and where you just be able to share things like seeds and other tools. You can get involved by actually going to those farms that are across New York State and buying from them, showing up to their farm to help with community work days. You can give money to their organizations, since so many of the funds that are supposed to get to them are not getting to them. And I would also say just buying locally, knowing who's around you, looking at the map on our website, connecting with other organizations, and being there, showing up for them physically and financially and all these other different ways.
Martha Williams, Executive Director of Administration and Programming for Black Farmers United, New York State. Thank you so much for talking with us about this important issue this afternoon. And again, we want to send folks to your website, blackfarmersunited.org. Martha, thank you.
Thank you. I appreciate it.
We'll be right back. While studies show that Americans are living longer, they may not be living healthier, and the growing gap between lifespan and health presents some long-term issues. The CAB Social Care Network strives to address home care and social service needs in underserved communities in New York City and Long Island. Here today to tell us more is CAB's Health Network CEO, Shirley Demosthenes Atkinson. I was so focused on mispronouncing your name correctly.
Right.
Demosthenes.
Right.
All right.
Got it.
Thank you for sitting down with us today. CABS has been around for quite some time, right?
Yes, it has been around since 1979. Based in Brooklyn, but it serviced the 5 boroughs, including Nassau County. So underserved communities have always been our focus, to ensure that individuals not only have the home care services that they need, but also trying to figure out how to wrap other social needs for individuals that we're already servicing, but also neighbors who are not part of our services. Yes, so we have been able to outreach as many individuals as possible. Now through the social care network, we're able to do that.
And why do you think, I think especially at this moment in time, that is such an important addition to your arsenal?
Well, we always seem to find individuals who wouldn't have access to certain type of services if they either are not receiving the right information or having the right set of services within their communities, because information is key to individuals searching and finding what they need. And CABS always try to find what the community needs and determine how to best service them. And now with the social care network, it is the focus to improve health outcome.
And essentially what you're saying is that yeah, these social factors are part of
Correct.
Of overall health.
Correct. Of course, social needs are not just home care. It is housing, it is nutrition, and it also transportation. What we did discover, and so was New York State, because the focus is to try to connect individuals to services. But particularly, I think the social care network under the Medicaid 1115 waiver is to more so have a focus on Medicaid individuals, because those are the individuals who are at most need to have health-related social service needs. And that includes what I just mentioned, which are housing, nutrition, and transportation, to help them actually live healthier lives and also help them improve health outcomes. And that's always the goal for us.
And how have people responded to, because really you broadened the work that you're doing. How have people responded to that? And are that, because in the past, talking to folks that offer the kind of help, sometimes people can be reluctant to let you know what they need, almost as if they're embarrassed, even though the need is there through no fault of their own.
Correct. And I don't think health care should be something to be chased after. What we try to do is to bring health and health services to the community. So for individuals who may not be necessarily be heard, about what they really need, CABS create community innovation hubs where we utilize spaces in communities that would not be necessarily be considered as communication hubs to discuss the needs of the community. So we find ways to allow for the community to be heard, to discuss their needs, and tailor those needs to make sure that we address all of the health-related social needs, not just if it's home care or care management, but care management also provides some level of mental health services. But the social care network now, it's formally funded to address those needs.
How are you just said it, that it's formally funded, because I was going to ask, how do you have the resources?
We didn't have the resources before. We were providing those services just as part of what we do in case management. But with the social care network, creating a system of social care network providers, because CABS is a contracted provider under 3 leads: Public Health Solutions, SOMOS, and also the Staten Island PPS.
There's a lot of talk, cuts to Medicaid, concerns about how that might impact your ability to provide some of the services that you do now?
Of course, because we depend on rate reimbursements, and if Medicaid funding is cut, that also will affect how individuals are qualified to receive certain type of services, especially with this, again, going back to the social care network, because it is so key in linking the additional services to individuals, not only the ones that we're already servicing, which are seniors and the disabled, but also the neighbors who would need that kind of service would not normally receive it. With the Medicaid funding cuts, this year may not be the year that they all feel it or we all feel it, but in the coming years we will see the impact of the Medicaid cuts.
And have you been in a position of trying to prepare for that, or?
As a not-for-profit,
yeah, it's hard.
It's very hard. And we rely on one activity that we do every year is the Circle of Care Awards,
And
which
that's
is
coming up in October.
Yes, in October. And we're looking forward to kind of do some level of fundraise and bring recognition to not only our partners, but our home care workers who actually support the work that we do. And as a matter of fact, this year we're actually honoring breast cancer survivors who are also part of the Silver Age group. And they're still working, providing the care that individuals in need require. So we're excited about that.
You guys are like the little engine that could. I'm going to send people to your website, cabshealthnetwork.org.
Correct.
And your Circle of Care Awards is scheduled for October 16th.
Yes.
Correct?
Yes.
And again, you're honoring partners and individuals dedicated to what your mission is.
Correct.
And it's even more important now.
Yes.
So, and can people use, I know it's a fundraiser, so if somebody wants to have tickets or whatever, if they go to your website, they'll be able to find
absolutely.
out information.
Absolutely.
All right.
Absolutely.
Thank you so much
You're
for sitting
welcome.
down with us
It was a
afternoon.
pleasure.
And look, there's so many people that without their services, they would not have the care they need. So you are
Absolutely.
doing really God's work.
Thank you.
Thank you very much.
You're welcome.
We'll be right back. Thank you for joining us on Here and Now. If you missed any portion of today's show, you can watch at abc7ny.com/hereandnow or listen to our podcast wherever you subscribe. If you'd like to comment or share your story, email us at hereandnow@wabc.com or follow us on Facebook and Instagram. I'm Sandra Bookman. Enjoy the rest of your day.